Good afternoon, everyone. My name is Ivan Valderas, and I'm going to be doing my presentation over orthopedic impairment for Adapted Kinesiology 4351. So a little bit about my abstract. I'm going to be talking about several things, which include but are not limited to what is orthopedic impairment, the type of orthopedic impairments that there is, a breakdown of what is neuromotor impairment, degenerative disease, musculoskeletal disease, the prevention, and if there is anything available in order to prevent orthopedic impairment, some facts that are apparent for orthopedic impairment, as well as how education factors in when it comes to these type of conditions, interventions that are given, and lastly but not leastly, the questions and the citation for the information where I derive my information from. So first and foremost, what is an orthopedic impairment? Well, in definition, what this involves is an impairment that adversely affects an individual and their activities of daily living. So some of these impairments can include what is called a congenital anomaly. And so an example of these things would be such as club foot, an absence of one of their limbs. This can be an arm, a finger, or even a leg, a limb that would cause them or impair them from performing a certain activity. An impairment caused by a disease. These can be things such as poliomyelitis, bone tuberculosis, or any sort of other condition that impacts their musculoskeletal abilities or their muscles in general. Or some other impairments can be derived from other causes, some of them which may be unknown. Orthopedic impairments are actually something that is very typical in our generations, and although some people may be born with these type of impairments, in other words, they're congenital, there are some people who unfortunately may come across a life event that may cause them to develop or to have an orthopedic impairment. And slowly but surely, due to this orthopedic impairment, this individual may need to adapt to their new lifestyle to be able to perform their activities of daily living. So there are three types of orthopedic impairments that are well known. The first one would be neuromotor impairments, and as you can see in these three pictures that are involved, they are definitely something that affects the overall type of life that this individual will have. There are degenerative diseases as well as musculoskeletal disorders. So some of these impairments might be seen, by the naked eye, or be able to see from a third-party perspective of how it affects an individual. In this case, I put a picture of an individual who is confronted by a flight of stairs, who, as you can see, although they have a tool that is adapted for them, such as this wheelchair, we can see that this area is not wheelchair accessible, and therefore it is an issue or an obstacle for this individual. On the second picture, we can see an individual that has a musculoskeletal disorder, and so in this case, this individual requires the assistance of a healthcare provider, or in this case, in this picture, it can be a parent. It really wasn't explained who this individual was, but needs the necessary help to perhaps sit down, or in this case, stand up. And on this third picture over here, sometimes these impairments occur within the detailed anatomy of our bodies, and so in this case, I included a picture of a spine where unfortunately there's things that we cannot avoid within our lifespan that can be degenerative, and in this case there's a focus on what is the red lining on this portion of the spine, which tends to be the breakdown or the wearing of the cartilage between our muscles or our bones, that unfortunately lead to very painful feelings in our body, and they cause us to limit our movements. So jumping into the first impairment is a neuromotor impairment, and this is actually something that is a result of damage to what can either be the brain, the spinal cord, or any other portion of the nervous system. And so with the neuromotor impairment, it's often a result that leads to complex motor problems, and although at times this can be limited to just one portion of the body, these motor problems can either limit movement, such as walking, raising of the arms, performing gross motor activities or fine motor skills, and it can even be as detailed as losing what is urinary control and loss of proper alignment of the spine. So this can affect the individual as a whole. Some of these neuromotor impairments are typically acquired at, or they can be before birth. So it's something that can be developed or can occur by either what is pregnancy issues or some type of damage that this infant or this individual can have early in their lives, such as a fall or a bad movement to the neck, and it can actually result of the parent not taking the necessary precautions in order to take care of their baby. Now, the two most common types of neuromotor impairments would include what is cerebral palsy and spina bifida. Cerebral palsy tends to be a non-progressive disorder of voluntary movement, and the posture of overall the individual can be affected, and this is a result again of what is damage to the brain. So it can cerebral palsy can cause either abnormal, involuntary, or even uncoordinated motor movements. And many of you who are thinking of going into these fields of healthcare perhaps at one time have come across a situation or a patient who might suffer from cerebral palsy. But I wanted to go ahead and show a brief video to y'all of an individual named Brandon who suffers from cerebral palsy, and this just kind of gives an idea of what this individual goes through on their daily life. So I'm simply gonna pull up that video, and here we are.
When I was born, they had to rush me off to a totally separate wing of the hospital, and they didn't even get a chance to pick my name, so they said pick something quick. My mom just shouted out the name Brandon, and that's how my name came about. When I was 3 years old, I was diagnosed with cerebral palsy and hydrocephalus. I have a shunt in my head that kind of helps drain the fluid with the hydrocephalus. I have been through 36 surgeries, and I've overcome all these challenges in my life, and that just kind of helps me get through stuff, because it's not every day that you hear a patient goes through 36 surgeries. I really have to give a lot of credit to my parents, because they said things are not going to be handed to you. You have to go out there and earn it yourself. I had a friend named Daniel who had this big hill that I'd have to climb up to get to his house. So every day I'd go out there and practice climbing that hill without using my walker, and I'd probably fall down, 20 to 30 times. And I just remember the neighbors watching me and asking me, do I need any help? And I said, no, I got it myself. Woo! Yeah! It was probably one of my biggest accomplishments. Gillette absolutely, without a doubt, has helped me redefine what is possible in my everyday life.
Go, Brandon! Go, 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 go!
I participate in Special Olympics a lot during the summer. I'm very active in track and field. I think my life has just taken off in terms of the mobility aspect for me. I've had a lot of elective surgeries at Gillette that I'm very proud of. I would say right now I'm kind of at the prime physical state of my life. I'm going to DCTC, Dakota County Technical College, and I want to study radio broadcasting and journalism.
Hi, I'm Brandon, and I'm here with Austin Greenwald.
My dream job would be probably working at KS95 or to be a play-by-play announcer for Minnesota Wild. When I was a kid growing up, my motto was
never give up, never back down, never lose faith. Because if you don't follow that motto, where are you going to get in life?
I find that's still absolutely true for me today. There's always stuff that you could complain about day by day. We can always find something, but then it's kind of like you're losing half the battle, because half the battle is mentally as well as physically. Gillette has been there for me throughout every facet of my life, and it's made a huge difference. And I believe that it is absolutely crucial for Gillette to be there for the future generations of kids to come.
So going back to the presentation, as you can see, an individual who has cerebral palsy does face several challenges throughout their daily lives. But as you can see with Brandon, although he had these limitations, especially since birth, he didn't allow them to impede his daily activities or what he wanted to be as an adult. So although he did confront several obstacles, he was able to overcome them. But what he stressed within the video is that his mental power, his mental outlook on everything was the most important thing, because there's always going to be something to complain about, but in this case Brandon decided to have a positive outlook on life, and that helped them achieve a lot of his goals. So referring back to the cerebral palsy, there's several types or classifications that include hemiplegia, which could be on the left or right side of the body can be affected. There can be diplegia, which the legs are affected way more than the arms, or paraplegia, which is only affected or center on limited movement on the legs, or quadriplegia, which affects all the limbs, which include the arms and the legs. Now, there's also what is considered degenerative disease, and as you can see in the picture, this is something that happens or can cross over the lifespan of an individual. As you can see on the first picture, there's really no signs since the child is able to stand up straight. And as the years pass on, in this case, within 8 years, you can see how the posture in the individual has changed. There's more of like an overextension or hyperextension of the individual, and this causes a stress on the joints and on the muscles, and it also causes weakness on the muscles. And as you can see, within the time period of 8 to 15 years, there's a great difference in what is the overall alignment of the individual. And as you can see, from the difference from 8 to 15 years, there is a loss of muscle mass. And this muscular dystrophy is defined as a group of inherited disease that actually causes a progressive muscle weakness or degeneration of these muscle fibers. So overall, as you can see, although the individual looks healthy as they were younger, as they grow older, they slowly start to lose this muscle mass, and they gradually become weaker. Now, most of these people who have this degenerative disease, although at one point in their lives they might be able to ambulate independently, unfortunately some end up having to need or have the assistance of an assistive device, which in this case would be a wheelchair. Some people might have crutches, some might have walkers or even canes that they might need in order to be able to move around. And unfortunately, there are some individuals as well that have trouble with either breathing or swallowing. Now, there are different musculoskeletal disorders. Of course, these do hinder motor skills, but some of the popular ones would be rheumatoid arthritis or inflammation, which, as you can see, and picture number 1, that's what a healthy joint looks like. Within the in between these two bones, there's a healthy amount of cartilage, and it's thick enough where the bones do not rub against one another. Now, with osteoarthritis, As you can see, there's a lot less cartilage between the bones, and this actually causes to be friction between the bones, and that's actually extremely painful. And with rheumatoid arthritis, there's inflammation within these bones, and it's actually very common within the elderly for these individuals to have rheumatoid arthritis, and unfortunately, this does not have a cure. Now, another musculoskeletal disorder would be limb deficiencies, which they can be lacking an arm, a leg, or as previously mentioned, a finger, and this can prevent them from participating in small activities or with fine motor skills, or participate in larger activities such as sports or simple tasks such as ambulating. Now, prevention, there isn't a way that orthopedic impairments can be prevented or avoided. Unfortunately, from the day that we are born, we slowly start to deteriorate or break down across our lifespan. And so it's a common saying that, or something that we hear within the elderly. I remember when I was your age, I used to be able to do such and such. And unfortunately, that's a fact. As we grow older, we grow more limitations, and sometimes although our mental state wants to push us to move forward, our physical state does not allow us to. However, there is services that are available to assist with orthopedic impairments, and like the video that we saw with Brandon, mental health is extremely important, as it is a giant factor in being able to focus on moving forward with different activities, and of course adapt or be able to accommodate in order to be able to complete them. Now, some facts of orthopedic impairments is that this is strictly off my source, is that the Department of Education reports that a total of 5,971,495 students are receiving special education services between 2003 and 2004 of the school year, and that of that number, roughly 1.1% or 68,188 students receive special education services based on a classification of orthopedic impairments. So it's also very great to note that many students with these orthopedic impairments actually do not have cognitive, learning, perceptual, language, or sensory issues. Now, orthopedic impairments in education, because some of these students with orthopedic impairments do not have cognitive impairments, it's very important that as an educator, we should collaborate as much as possible with the students so that we can accommodate them to the curriculum as much as possible. However, each student or each individual with an impairment has many factors involved that can determine what is their limitations and what it is we can do in order to provide them with a education. Now, there is different assistive technology that helps these individuals, fortunately, such as speech recognition software, screen reading software, augmentative and alternative communication devices, assistive devices as well for motor skills. So there can be things such as canes, crutches, wheelchairs, or in this case, we have an individual who has limitations in their gross motor skills, and so they need the assistance of a screen and a speech recognition software. Or those who have difficult or who have impaired speech can use charts or visual illustrations to be able to tell others how it is that they feel. So there's different types of intervention with these orthopedic impairments, such as physical therapy, occupational therapy, and speech therapy, and us as physical education teachers can also intervene in helping these individuals to be able to provide them the tools that they need in order to succeed. Now, physical therapists work on gross motor skills, while occupational therapists work on fine motor skills. Speech therapists clearly help in one of the most important things, which is communication. And us as physical education teachers, we work along with the occupational and physical therapists to develop exercise programs for them. Now, these are the questions that I have. What are the 3 types of orthopedic impairments? Can orthopedic impairments be cured? And what are the 2 most common forms of neuromotor impairments? So take a few minutes and you can go ahead and analyze these questions and write the answers to these 3 questions for your own records. And these are my citations. Thank you so much for listening to my presentation on orthopedic impairments.